Hello, this is Dr. Radley, family physician in St. George, Utah. Today I wanted to visit with you about a conversation I had earlier this week with a patient. And one of the things I wanted to discuss is, are you aware of what are in your supplements? So many times patients come into the office and they'll tell me that they don't want another prescription because they're taking too many pills already. And then they'll dump out their bag of their pills, and what it will be is 15 supplements and maybe 2 or 3 prescriptions. And it's so frustrating when I see that, to see that I have someone who would put more emphasis and stock in taking a supplement to treat what it is that they need to than trusting a pharmaceutical that is usually tried and true and proven. So the conversation I had with a patient this week is, she was taking a supplement for a medical problem which wasn't being controlled, so we were talking about using a prescription that she probably really needed to be on instead of the supplement. And one of the things that we got into the conversation was that, does she really even know what is in that supplement? So most people really do not understand that supplements are not regulated by the FDA, the Food and Drug Administration. They really have nobody policing what is in those supplements at all. So there is no quality assurance. There is usually not continuous batch testing to make sure that what is in the supplement is exactly what they say is in it and nothing more. There is usually not that level of safety and standard of care that goes into the same thing as most pharmaceuticals do. If you're going to take a pharmaceutical, you can usually guarantee that that pharmaceutical company is being held to a very high standard and having to test batches on a regular basis to make sure that the drug that is in there is what should be in there at the level that it should be in, to make sure that it's continually efficacious from batch to batch, and that there are no other impurities or other side drugs or chemicals that have found their way into that. A recent example of that is the valsartan blood pressure medication recall. While it was being batch tested, it was found to have a contaminant that is a known carcinogen or cancer-causing drug in it, and it's been pulled from the market. So you know that that process is being done. The other thing is that there's oftentimes when patients will come in and complain because they can't get a medication at that moment because it's on back order or on short supply. Again, I try to explain to them that when that is happening, I know it's frustrating for them and that we might have to temporarily find an alternative or find a way to work around that, but that is because that warehouse or manufacturing plant where that has been produced has had a problem with their production line, and because of that it's been taken offline for a temporary period of time until that can be corrected to make sure that you're getting exactly what you should be doing in that medication. So I wanted to discuss the pharmaceuticals in general as far as supplements, a multi-billion-dollar industry that's not regulated. I have a couple of examples here, and I will put up screenshots to show you exactly what I'm looking at a little bit closer, but this happens to be a zinc supplement that I've purchased. Nature's Bounty. I like Nature's Bounty and Nature's Made. I have looked into these particular brands of supplements. I am not advocating for any particular brand of supplement. I want you to do your own homework, and what you'll find is that even in a particular supplement line, it still may not be consistent from one supplement to another throughout the line. So you can't automatically just guarantee that that's the case. They might have a higher standard, so that's something that you want to look into, but you just need to be aware. So in this one, so zinc supports immune system function. And notice there's a little asterisk here. Again, I'll give you a screenshot for this, because the supplement industry can claim just about anything short of saying that they cure cancer and get away with that, because they don't have to prove the claims that they put on their bottles. So I want you to be aware of that when you do purchase supplements. The next thing I want to show you on the supplement bottle is on the back there is a little paragraph here, and it states the statement has not been, sorry, I'm going to have to get a little fine print here, has not been evaluated by the Food and Drug Administration, and this product is not intended to diagnose, treat, cure, or prevent any disease. They're required to put that on here by the Food and Drug Administration because of that very fact. They don't have to prove what it is saying that it's going to do, They don't have to prove efficacious that it's effective. They don't have to prove the safety. They don't have to prove quality standards. Nothing. And so just to prove you that it's not just a single supplement, here's a magnesium that I've purchased from Harmon's. Again, on here promotes optimal muscle, nerve, and bone health. Again, with a little mark because they have to put the asterisks on there. And this has exact same sentence. These statements have not been evaluated by the Food and Drug Administration and is not intended to diagnose, treat, cure, or prevent any disease. So you're gonna put more stock in a supplement and buy something to treat yourself than you would a pharmaceutical that's been tried and tested. I want you to think about that, really. And when you dump out a bag of supplements of 12 things that you're taking because they're not chemical and they're natural, just think about what you're saying. So let's just dump this out here for a second. Here is a tablet of the zinc. It is a pill. It is no different than any other pill that you're taking. It has medication in there along with a filler that has been compressed in a tablet. And you hope it doesn't have other things in the filler that are not in there that shouldn't be. You don't know because it's not being usually held to the same levels and standards. So this is not a plant-based food. This is not something that you went out and picked out of your garden. So when you tell me that this is natural, I want to show you the product. This is not natural. This is a tablet. This has been synthesized. No different than a chemical from a pharmaceutical company that's been tested and tried over and over again, proving that it's going to do what it says it's going to do, whereas the supplements have not. This is not a natural form. It is a pill. So when you say that I want to take something because it's natural, take a look at what you're putting in your body. It's a pill. It doesn't necessarily mean that it's not any different than anything else that's made into a pill form. When you dump out, again, that bag of supplements, you're putting multiple chemicals into your body at the same time. Again, no different than if you were on 10 or 15 drugs from pharmaceutical companies, something that you were given as a prescription. All those things do potentially have side effects and reactions in the body. And we make an assumption because it's a supplement that it's perfectly fine for me, and it does not. And that is not true. So you have a greater problem of having potential side effects because supplements are not regulated by the FDA, neither are their side effect profiles. You can be on multiple things that might be contradicting each other, that might be contributing to buildup of side effects or toxins or excess metabolites. They might be counteracting with your regular prescriptions that you have, and you don't know because you can't do a very simple chemical to chemical or chemical to drug screen from a supplement that you can with other pharmaceutical agents. So when I hear people say that argument and claiming that this is safer for them because it's all natural, I get so frustrated, honestly, because I want them to understand what they're doing. And that doesn't mean that you're not inappropriate to be able to using supplements if you've done your research and you've researched the brand and you know that it's going to be effective for what it says it's supposed to be, and that you're getting a product that is going to not have a lot of impurities in it. But do your homework first. There is a company that is an independent company, and there might be more than this one, but this is the one that I know about, who does do pharmaceutical testing for supplements. And they try to give you a grade on supplements across the board, comparing apples to apples and looking at those things that we just talked about. So I, again, will share a screenshot of that company, but let's go ahead and pull up a few of the things that they test for so that you can kind of see what you're looking at. So the company's name is called Labdoor, www.labdoor.com, and you should be able to hopefully see the screenshot of it now so that you can see what it is that they do. So they rank, again, supplements. They're not looking at pharmaceuticals that are regulated by the FDA, and they give you several different categories that they do rankings on. So you can pretty much type in any supplement that you want to look at. So I'm going to go ahead and look at their magnesium because we've given an example of magnesium today. And then they're going to show you the ones that they've tested. Now, this is time consuming and expensive. So unfortunately, they're not going to be able to test every product that's out there on the market. And especially if you've ever gone down the supplement aisle, you know what I'm talking about. There are hundreds and hundreds of supplements, and often of the same type. So for example, you could go into almost any grocery store and find probably 5 or 6 different magnesiums. And that's not a health food store. If you go in a health food store, it's even worse. You're going to find so many different variations of this, plus what you can get online. So they're going to look at some of the more commonly used supplements, and they're going to grade those to see how well they meet on quality and on doing what they should be doing. Now, they do give you the option of buying their supplements online because that is how they support their site. Is if you buy the products directly from them, it helps them continue to stay in business to be able to do what it is they're currently doing, which is an amazing thing. So here are the rankings that they're going to give you. They're going to give you a overall ranking compared to all the products they've tested. So a 1, 2, 3, 4, 5, etc. ranking. They're going to give you value ranking as far as how good does this product rank for the take compared to the costs. They're going to give it an overall lab door score, and that's based off the categories that they measure. So they're going to give you label accuracy. Does the label actually state what the product is for? And does it have the disclaimers on it? Is it going to not have outrageous claims on there that they can't back up? They're going to give you a rating on product purity. So is what in the product what they claim is in the product, and only what they claim should be in the product. They're going to give it on nutritional value. So again, based off of, is it going to do what it says it should be doing? And that's going to be based off of information that we know can validate the things that we do know, for example, that magnesium should do. Ingredient safety. Are there other impurities in there that were picked up along the way? So again, in product purity, it's not only that the product has in there what it says it has, but it's also that the percentage or concentration that they claim is going to be in there. And then the projected efficacy. So based off of those testings, is it going to do what it's designed to do? So anyway, they take those ratings. You can go inside of their website and look in more detail how they come to each of those conclusions, but they're going to give the product a rating. And so this is a great way if you're trying to do some research on supplements to be able to see if there's something out there that's going to be a better supplement than another, if you're insistent that that's something that you want to take. So please just be aware that supplements are not truly all natural. They are being synthesized as a pharmaceutical, just like any other drug product is that you might get as a prescription, that they do have potential side effects and interactions that can be there, and that they're not necessarily quality tested and as pure as you think they might be, or consistent from batch to batch the way that you may want them to be. So do your homework, find a product that is going to be consistent and reliable to be able to take, and try to not make your physician or your provider frustrated when you bring in your bag of supplements, because you've actually done due diligence in taking what you need to be taking. So until next time, this is Dr. Radley, family physician in St. George, Utah. Pura Vida.